the foreseeable opportunities of AI for medicine right now?
Well, artificial intelligence, which is included in what we can say is digital technology as a whole, has had a huge development over the last few months, few years, and it's having a major impact not only in healthcare and management of different conditions, but also in promoting healthy lifestyles and basically helping people to be more organized in terms of understanding better what are the benefits of having those healthy lifestyles and having access to information that otherwise would be more difficult. On the other hand, the development of digital technology has been quite amazing. Today we have different ways in which digital technology is being used in medicine, from some devices that from simple Apple Watch to some apps in our iPhones or our portables, and that actually brought a different reality, which is the ability of people, everybody, having the possibility of, on one hand, being monitored, if they are patients, for instance, or if they want to know about some health conditions, and also to have access to information. So one of the big goals of digital technology is actually to narrow the differences among people. It's actually to be able to provide more capacity for the population, even in remote places, because we know today, even in low and middle income countries, the access to iPhones is very high. So the possibility of using digital technology to send that sort of information, to connect people, because information is knowledge, knowledge can narrow the gaps between people, is very relevant. So in brief, I would say that digital technology can help, on one hand, the general population in having access to information more easily and use that information. On the other hand, in the patient population, is being very useful in providing new tools to help us to monitor patients, to do early diagnosis, to even monitor treatment strategies that we are using, for instance, in heart failure. Heart failure is a good example on the use of digital technology has had big impact. In our place we have now a program which is running already for a couple of years, a group of patients with heart failure, with severe heart failure, that were admitted, they were discharged and they were put on a program where they are remotely followed and monitored, and that actually had an impact in terms of reducing mortality and reducing rehospitalization. So it's just one example where digital technology can help us to do better patient management.
The impact on world cardiovascular disease and the role of AI. Can you tell us something more about it?
Artificial intelligence is a tool, and it's a new tool which basically provides the possibility of having access to millions of data points, and with that make and develop algorithms that individually we are not able to do it as human individuals. So it's basically by using computer science and by collecting all this data, being able to have a more accurate way of looking at different conditions, for instance ECGs, imaging, developing algorithms also to do diagnostic algorithms, treatment algorithms, and I gave a few examples like using ECG. Now there are several algorithms where we can use artificial intelligence to help us to do early diagnosis in conditions that if they are diagnosed earlier, they can be treated earlier and they can change completely the natural history of these conditions. One good example is amyloidosis. We do have data now that shows that with artificial intelligence and by using some of these algorithms, we can do an early diagnosis like 2 years before we will do if we use conventional methods, which is when we already have some full-blown picture of the amyloid heart. And that can have a major impact if we can do that early diagnosis, start treatment earlier, and have an impact in terms of the prognosis of that specific patient, and therefore modulating also the natural history of these different conditions. On the other hand, artificial intelligence is also about big data, and the use of big data has been, of course this is work in progress, but has been very important in the understanding of many different clinical conditions, not only in cardiology, of course. In oncology, for instance, there is also a lot of work done in this field, and basically doing what we can say that is making medicine even more human. and by using these resources, being able to do what one of our colleagues, Eric Topol, has mentioned as deep medicine. So being able to have and to use this unique ability that we have now to collect all this data, and basically by collecting all this data, having a better understanding of different conditions and therefore develop better strategies to do patient management, which is, at the end is our main goal in the patient population. By doing this collection of big data, also can help us to do early interventions, and that's also one of the main goals that we have as a community as a whole, because if we can also influence the way people can change their behaviors, use better lifestyles. It's also been done, for instance, in nutrition, helping people to choose according with their own features, what has been called also as digital nutritionist, which is collecting all the data of the individual and helping the individual to define its own diet, its own way of doing healthy choices in food and some other aspects. So it's a field ongoing. It's evolving. It's been amazing the developments, the computer developments that made it possible in terms of computer science, in terms of data mining, and certainly opens the door to a lot of important potential uses of this technology to help to do on one hand prevention, on the other hand do better medicine in terms of diagnosis and treatment. And will never replace the human being. That's a big concern always. I think we need as medical community to be involved, to be engaged, to try to understand better what this wonderful tool can give us and can provide us with all this type of structure that at the end can help us to do better understanding of different conditions and therefore better patient management.
Well, you are the president of this organization, and what are the purposes of this really important institution nowadays, and what you expect to achieve in the next, say, 5 years in the future?
Thank you for the question. The World Heart Federation, as the name indicates, is a federation of scientific societies, foundations, patient organizations. It's based in Geneva, Switzerland. It's the official link with the World Health Organization for cardiovascular issues, and the mission is to provide cardiovascular health for everyone. It's a very ambitious mission, but that's the mission, that's the goal. The ultimate goal is to develop strategies to provide cardiovascular health for everyone. And that is being done through different strategies. The main pillars, on one hand, is to translate science into policy. So what we develop is different ways of providing what has been the evidence, what science has been showing us, and then to translate that into policy, meaning into changes that can be done in the countries, in the regions, so they can affect in a positive way the populations. One good example is, for instance, all the laws about tobacco cessation, about smoking. Those have been based on the evidence that has been obtained by the scientists and then provide that information to the decision makers to take the right decisions. But also on the use of salt, the use of front package labeling, providing information, scientific information that can help also the governments to establish better strategies on, for instance, managing hypertension, dyslipidemia, and many other conditions. So that's one of the pillars of the organization, is to do that, and do that through different activities that are being organized under the organization. Another important element is to connect the cardiovascular community, and that's why having all these members, and we have members like big members like the European Society of Cardiology or the American College of Cardiology, American Heart Association, Chinese Cardiovascular Association, Japan, Brazil. So one of the purposes, and we have of course small organizations, is to provide this connection, this network among different organizations that can exchange information, which is the third pillar. So translate science into policy, connect the cardiovascular community, and exchange information in terms of what is the science, what is the evidence that can help then to develop strategies that can do better understanding and better ways to achieve our goal of cardiovascular health for everyone. And we do this through different processes, through different events. We've been organizing, for instance, what we call the roadmaps. In the roadmaps, what we do, we basically, for different areas like atrial fibrillation and heart failure, coronary heart disease, we organize a group of experts that reflect on what is the evidence, what do the guidelines show, and then try to understand what are the roadblocks for implementation of those guidelines and to provide solutions to overcome those roadblocks. Why guidelines on heart failure are not implemented? What are the roadblocks in diagnosis, in prevention, in therapy? And then this is worked together with some of our members at local level through roundtables that are organized in different parts of the world. We've been doing this in Africa, in Europe, in the Americas, in Asia. And then with the local societies, we organize these roundtables where we discuss what are these roadblocks and how relevant are they at that specific country or region, and how can we implement strategies that can help us to overcome some of these roadblocks or limitations in, for instance, implementation of guidelines. So that's one of the areas. We are undergoing now a big project which is called the World Heart Observatory. And the World Heart Observatory, which is a new project, is an observatory which will be based in Geneva, and basically will collate the data from our members and from our partners like WHO, like GBD, the Global Burden of Disease Group, and also from some of our members that already collect data for a long time, like ACC, AHA, ESC, and many others, and organize that into our website where we're going to discuss specific issues that, again, we want to be discussed, so then they can be used to influence structures, governments, decision makers. So it's what I call the United Nations for cardiovascular issues. It's composed of all the different members around the world, and with this sort of network and of connections, we really think that it's a very strong advocacy structure that can provide the sort of support around the world to help to disseminate knowledge and to help to disseminate what we believe can help to shape in a way that we can achieve, again, our goal of cardiovascular health for everyone. It's, of course, a long-term project, but we're very excited, we're very enthusiastic with the way all our members have been engaged, and we also aligned very much with WHO in achieving the next goal, which is to reduce by 1/3 premature mortality by cardiovascular disease by 2030. That's also one of our goals together with WHO, and with all these different elements that I've mentioned to you, we are working to achieve that as well. So it's a great organization.